Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
There's an interesting article, Tuesday's post talking about not your dad's old age, living better, wiser. And this son, who's about 50 at the time, decided he was going to learn from the mistakes his parents made because his grandparents died from falls, and his father needed a cane but wouldn't take it and kept falling. Then he needed a walker and he wouldn't use the walker. He kept falling and finally died because of a fall in which he broke his ribs and wound up dying for complications of that. So he talked about how he was going to try to do better than his parents and learn the lessons from his aging parents. He talked about the fact that he was going to use the cane when he needed it, use the walker when he needed it, and also to use a hearing aid when he needed it, and to be socially engaged, to keep moving and exercising and smiling as much as he could. And so he's suggesting that small steps as you age can help you age smarter and maybe help you live a little longer. As we know, falls are probably the number one cause of people who age dying after cancer and heart disease. And for many, it's the fall they have is the last fall that they have. Any of you have any family members who are resistant to using canes and walkers?
My mother, she didn't want to use a cane. She would hold on to the wall and hold on to everything else. And she finally got around to the cane, but then as time went on, she needed a walker and she wouldn't, she couldn't get used to those rollators. So I bought her the old type of walker and she did well with that when she finally did, but it was a fight to get her to use those things.
Yeah. Well, aging is a complex process, and some people adapt and some people don't.
She didn't want me to call 911 because she didn't want the neighbors to see her going out of her house on a stretcher.
Pride goeth before destruction, huh?
Yeah.
And the haughty spirit before a fall. Yeah. But falls really are something that often will take us out of here. John, you had a lot of falls, hadn't you?
I had 3 falls. Yeah, I had 3 falls, but before the fall, the falls were because the legs gave away. Legs gave away gradually. I could tell that steps were getting harder and harder and harder for me to climb. This is all before the fall. And so the first fall, that was the worst one. And so I just fell. So if I had been doing exercise to keep my legs strong, I could have avoided all those falls.
Well, it's something to be aware of and to try to help your aging parents and yourself to work with it. How do you get aging people to accept canes and walkers?
Darryl, your dad told me that when you get elderly, your legs go first. That's what he told me. But I don't know your answer to your question. How do you get them to keep from, to continue using canes and wheelchairs and everything when they're too stubborn. I don't know how to do that.
If you're used to being active, I think if you're used to being active, it's probably not so much of a problem. I don't know, but I know as much as I go and love to go and do things, if it means a cane, I'm doing it. If it means a walker, I'm doing it. You know, if it's going to keep me engaged and mobile and doing things.
So it's a mindset, huh?
I think so. It's part of it anyway.
Yes,
Some
just
people
really
are
important to
content
keep.
to be home, though. You know,
Look at me for.
some people are content to be home.
Yes, I am.
But most of the falls are in the home.
True, that's true.
Yeah. Well, keeping the legs strong. If you walk every day, if you walk some distance to get that cardio in, helps to keep the legs strong.
Yeah, that's right.
When you're old, you're old.
Yeah, but being old doesn't mean that you stop exercising or stop walking. It doesn't mean you have to give in to your age.
Yeah.
Yeah, I think exercise is one of the
Yes.
most important aspects of aging.
I'm talking back to my husband because he's one of those that doesn't feel like he needs to exercise.
Oh my goodness.
I'm down steps.
He goes
Well, I
up
think
and
that-
down the steps maybe twice a day, and he feels like that's enough exercise. And it
Yeah.
is not. It is.
After
Well,
the
the-
age
the
of
other
40, after the age of 40, exercise is vital.
Vital.
Yeah, well, if it
And
takes them 150 minutes, then that's okay.
It doesn't take that long.
yeah.
Isn't
Well,
that right,
the other
Dr.
thing
Callender?
is,
150
He's
minutes.
listening to all of this, but I'll
That's
let you
good.
know next week whether it took hold.
the
Yeah,
other thing is that over 60, when you work out, you're prone to hurt yourself. You know, you get these little injuries. And it's good to, rather than just stop working out because you got an injury, you go to the doctor and see what the problem is. And a lot of times they'll recommend some physical therapy that'll help strengthen whatever you're doing wrong, work it out so you can get back on track again.
But it doesn't take anything to walk.
You
You
got
can
to
just
do it
walk
150
around.
Yeah,
minutes first.
You can walk around in the house.
It takes a mindset,
Yes.
Yeah.
positive
Well,
mindset.
okay. Even when you walk, like John Buchanan walks, 5 miles a day?
I used to
That'd be
walk
100.
6 or 7 miles
Yeah.
a day. When I started,
All
it
right.
was miles, but
Yeah.
now
But even when you're,
yeah,
when you're walking those long distances, you can, walking by itself is not enough because you can get some sore knees, sore hips, sore feet. And that's because you got to walk and strengthen. You got to cross train when you walk. You got to stretch. And so when you don't address those things, physical therapy can help you tighten up what you left out.
That's true.
Good advice. The other article that was interesting was an interesting article on multivitamins. We've talked about that many times, but most of the articles and the research has demonstrated that eating healthy is wiser unless you have a nutritional deficiency, and that can be tested for. But eating healthy is the wisest thing. If you want to take vitamins, it's okay, but you can't substitute vitamins for eating healthy. Any other comments about those things before we start our articles?
Yeah, still the minimum is 150 minutes a week at the absolute minimum.
Absolutely, yeah, correct. Thank you. Okay, let's start the articles.
We.
I guess the first one is provocative. Oh, this is an interesting education article about APOL1 mediated kidney disease. This is a type of glomerulonephritis that is very genetically associated with people of color, African Americans, Afro Caribbeans, and Latinos have this APOL1 gene. And if you have more than one of these genes, then you're likely to have focal sclerosing glomerulosclerosis, which is the cause of kidney disease in 75% of people of color. And this is something that really was addressed maybe about 10 years ago, when it was recognized that the disease that prevented you from getting Africans from getting sleeping sickness was the same gene that made you more likely to have focal sclerosing glomerulosclerosis. FSGS is what we call it. And this is perhaps one of the reasons why we have so much kidney disease. We now recognize that most of the kidney disease that we have, by the time you make the diagnosis of kidney disease, the kidneys are already shrunken, and you can't get a biopsy to prove what is the cause of kidney disease. And people who have studied causes of kidney disease, they label it as hypertensive kidney disease or kidney disease of unknown origin. And most of the studies have only had about 5% of people of color. So getting genetic testing, if you have kidney disease, becomes something that is important. And if you have an APOL1 variant, then this is something that can help in the diagnosis of a type of kidney disease that we're more prone to than most people. And so as a consequence, April the 30th, they're going to label as AMK Awareness Day. And so MOTEP has agreed to work along with them as we try to make people aware of the fact that genetic testing can help you make a diagnosis of a kidney disease that in the past has often been unrecognized.
Dr. Callender, I wanted to highlight that AMKD Awareness Day webpage. You can click on that and it'll take you right to the webpage.
Okay, any other comments or questions about what I've said so far about AMKD Awareness Day? Anybody understand what I was talking about?
Is it just going to be announced, or are they doing something special?
Yeah, they're going to announce it and ask you to participate in telling your community and your friends about the need for genetic testing to find out if you have this genetic kidney disease. We've labeled a lot of the kidney disease as hypertensive kidney disease, as diabetic kidney disease. In many instances, it may well be APOL1 mediated kidney disease.
So can we just ask for the testing from our doctor, our primary care? I mean, the tests?
Genetic testing is available from your doctor. They just have to know how to do it. As a matter of fact, as part of our screenings now, we do genetic testing for people who have protein in the urine, because the earliest sign of kidney disease is protein in the urine that occurs long before the blood tests change. And so that's the time you can get genetic testing to find out if you have this disease. And so this is part of our screenings that we do on a weekly basis. We go into the community.
I have a question. If you do the testing and you find out that you have this gene, could gene editing come into play?
That well, as a matter of fact, down the road it may come to play. They just beginning to use
CRISPR.
ways of decreasing the impact of the two genes together. But so far, yes, down the road it could come into play. How so? I'm not sure, but it certainly uh, is amenable to gene editing.
Thank you.
It's just like, for example, we started National Minority Donor Awareness Day in 1996, and it's now awareness month. Same thing could happen with this. Depends upon and as part of the toolkit materials they talk about is making aware that there is genetic testing that can identify whether you have one or two of these genes. Okay, if there are no other comments or questions, this is the next, which is something that when the NASEM, National Association of Science, Engineering, and Medicine, identified transplant as not being equitable. One of the things they talked about was the fact that this needed to be done away with. And that is having a different formula for determining kidney disease in Black people in contradistinction to other ethnic groups. And as they've done this, they identified, as you can see in this article, that there's close to 14,000 people who were 14,000 people were identified who lost waiting time. And as this waiting time was restored, this article shows that thousands of people have subsequently, more than 2,800, subsequently been transplanted. And so the question is, how many people really had to wait longer because of this test that modified the creatinine levels because of the fact that they said Blacks had more protein, and therefore they had to stay on dialysis a little long. They had to actually wait a little longer to get on dialysis. And then, of course, it's been recent that the waiting time has been changed to begin when you start dialysis. So this GFR is the estimated glomerular filtration rate is what had been modified. And creatinine, it's all about creatinine. And they allege that because we had more protein, we needed to have a different GFR, which has turned out not to be anything other than discriminatory.
Dr. Callender, I had a serious question about that because so many of our percentages have not included this factor, right? The percentages of
All percentages include creatinine.
no. I'm talking about the ones who were discriminated against because of this percentage. And as far as the number of African descendant Americans that needed transplants or qualified for transplants or could give transplants, wouldn't this affect those numbers?
It affected those numbers of people who needed to be on dialysis or needed a transplant.
Yes.
And there was 14,000 of them who fit into that category. But your question was what? Did I miss your question?
Well, I was saying, when first time I heard you, we were talking about the number of Blacks who donated and the number that received transplants. And there was a very high number, a very high percentage of Blacks that have received transplants, but a low number of the donors. And I was just thinking that not including this factor, having, having a delay or misrepresentation of those Blacks that actually needed transplants but were discriminated against because of this test, that those numbers of need and donation need would be skewed a little bit, I think. I don't know.
Donation rate wouldn't be affected, but recipient rate is significantly affected. However, it is true that we haven't looked into the donation process because in order to be a donor, you have to have healthy kidneys, and so it's unlikely that it would affect the donation rate, but it hasn't been looked at. So it's interesting that so far 2,000 people have received transplants as a consequence of changing of the waiting time based upon this. Also, at the same time, one of the reasons why we had longer waiting times was that a lot of the patients didn't get on dialysis. I mean, who got on dialysis, who didn't get on the waiting list until the doctor said it was okay, and that has changed. So that now, as soon as you start dialysis, your waiting time for transplant begins. So that's changed as well. There's a number of things that have changed over the last 20 years that have made transplantation for people of color more equitable. But it's still not where it needs to be, but it's moving on the way.
Dr. Callender,
Yes.
how long can you stay on dialysis?
Well, we have some people who've been on dialysis for 20 years.
Oh my.
But it's thought about 50% of the people who start dialysis are dead within 10 years.
Oh my.
So, but most of the people who die because of kidney disease may often die before they even get to dialysis because of the fact that sometimes they don't make the diagnosis until it's too late. So they may have heart attacks and other complications. Any other questions or concerns about this evidence of discrimination that has now been modified?
Yeah, my question is, okay, apparently they came up with a reason some time ago to have different testing standards for kidney disease by race. Are there other diseases, conditions which the racial testing is still going on, where there's differences in test results by race?
I think this is the last one.
It's good to know.
Yeah, sad. Okay, let's go to the next article. This is a article that talks about the fact that we ain't seen nothing yet, and that the number of people with cancer will rise 77% by 2050. They don't really talk about why, but they do point out that there are 10 million deaths from cancer. One in 5 people alive now will develop cancer in a lifetime. And it looks like more men than women will die from cancer. Now, it is thought that much of this rise is due to the fact that we will be living longer. And as you age, the incidence of cancer increases. And we're recognizing that the largest growing population in the world is the aging population. And this is why there's a concern. It's interesting that lung cancer was the most frequently diagnosed form of cancer worldwide. What is interesting to me is that in spite of this, smoking is still so common in Europe. And that means that the cancer rate will continue to rise. Then, of course, we know that the HPV virus that we're aware of is not tested for in some of the other countries. And this causes the cervical cancer that young women die from. One of the sad parts of it is that half of the cancer deaths are potentially preventable. And this is the sad part of the whole story. So we don't have equitable allocation of resources across the globe that would allow for a decrease in the preventable cancers. Prostate cancer is projected to double as well. And that's still the most common cancer in men across 112 countries. So this is a kind of a sad global story. As we age, we get more cancer and we die from more cancers. Any comments or thoughts about this? This would make concerns about addressing those preventable causes of cancer, eating healthy, exercising, meditating, and doing all those things. And they're making the same observation that I have, that tobacco remains the principal cause of lung cancer, which is the biggest problem all over the world. And I'm distressed that what we've done in the United States is take this poison and distribute it to the rest of the world. Any comments or concerns about some of these issues?
Yeah, I'm just I'm surprised that lung cancer is number one, and some of the non-smoking causes of lung cancer high on the list is air pollution, and so a lot of people are considering. A lot of African Americans are considering expatriating, and a lot of them are thinking about West Africa. But West Africa has some of the worst air pollution in the world because of Saharan dust events and biomass burning. So, I mean, they burn a lot of carbon products in West Africa. So that's something to think about if you're considering migrating to West Africa. On the air pollution side of things, it's the worst place to go.
This paragraph at the end talks about the lack of screening mammograms in Saharan Africa and China, or colonoscopy. And so these are ways of preventing some of the cancers that are not available. Any other comments before we move on?
I'm looking at that last paragraph. So because the United States has a lot of screenings, do we have less instances of cancer than some of the other countries?
That's what we believe, yeah. Mhm.
Okay.
Especially those places that don't screen.
Yeah,
Right.
that's what I mean. Yeah, okay.
Okay, let's go to the next one. This is an alarming recommendation from HHS that hospitals must get written consent for public exam, especially since we still have problems with cervical cancer still being diagnosed, and you can't do that without a public examination. But in the past, it is not required written examination. You get consent, but you did not require written consent. So this is going to change now, and this is going to be an interesting requirement for hospitals to get written consent for public examinations, which has never been done before.
Mm.
What are your thoughts about that?
My question is why, Doc? Why would they require that now all of a sudden?
Because there's a lady there who testified and said that she felt that it was important to have written consent before you do a pelvic examination, especially if you do it under anesthesia. And so they brought this case and they discussed it, and after they looked at it, they made it a condition for participation. And this is brand new. She apparently had an unauthorized while she was under sedation in the emergency room. I don't know how often that happens, but that is the reason why they decided to do that.
Mm.
So what was she saying? That she had been abused or something?
She said received an unauthorized public exam while she was asleep in the emergency room.
Weren't they trying to find out what was wrong with her?
I can't answer that question. I can only say that she complained about it, and as a consequence, they decided to change and require express consent. I don't. They don't. They don't detail the circumstances.
Is that just in Utah, or is that the law of the land now?
Now that has become the law of the land. So
So what this will lead up to, you come to the emergency room and you're unconscious. They got to wake you up somehow so they can examine you.
that's what happened. I think
That
it's
makes sense.
it doesn't make sense to me, but it's something that
So there is no logic to this whole thing, but yet they still pass the law.
that's correct.
Because this woman was crapping. Okay.
I have a question. It seems like there would be two forms of consent, written consent, because the first one is you have to give written consent to go under anesthesia.
Right.
And so the second one would be written consent to do a pelvic exam. Now,
Yeah, I think under anesthesia, you might require it. If you're gonna get consent for anesthesia, you could get, but I don't know anybody who does a pelvic examination without the patient's permission, without it being considered abuse. One of the things that you have to be aware of is that medical profession is the only profession where actually you actually invade somebody's body, but you do it with permission. And so to have this as a written consent for pelvic exam to me seems a little backwards, but that's what they're going to require.
Okay,
Dr. Callender, what if somebody finds you on, you know, people are treated all the time without permission. If you find somebody unconscious or in distress, then they treat them or they have to, don't they?
Yeah, I think that most doctors would feel that if they find you in that condition, that that would be a reason for you to do an examination.
yeah, but
As
not a
extensive
pelvic.
as extent. Well, it could be. It depends. If you have an abdominal symptoms or you're distended, you may need to do a rectal or a pelvis examination. They're talking about uh, pelvis examinations, meaning rectal and vaginal examination.
Okay, so my question earlier was, in this case, would there be two different uh, consents, one for anesthesia and another one for pelvic, or could they just do one consent for the pelvic exam, knowing that the person would have to go under anesthesia in order
You
to?
need two consents.
Okay, thank
Do you think this has anything to do with abortion?
No, I don't. I think it has to do with uh, a woman complaining about having an unauthorized pelvic exam while she was under anesthesia. And
They
why,
couldn't justify it.
I'm sorry?
I mean, I could understand Dr. Callender if they went in there to do a throat operation and she finds out after the operation that she had a pelvic exam. But how would she know?
They don't give any details in this article.
That doesn't make sense to me.
And she looks perfectly sane.
What'd you say, Carol?
She
She
looks
looks
she looks perfectly sane.
Yeah, well, they don't
See,
give details in this article, but they do tell you that this is now required.
mm, mm, mm.
Well,
I
you
think
can't
maybe
tell a book by its cover.
That's true.
I think maybe she thought maybe she was violated or could have been. So
you. Yeah, you know what? This lady came out of anesthesia, woke up, and the doctor said, "Your throat is okay, but we found something in your pelvis." And
We
then
don't
he
know
said,
that that's the case. That's your
yeah,
speculation.
exactly. And so the lady wakes up and said, "What do you mean something wrong with my pelvis?"
But that's speculation, John. That's not
I understand.
fact.
I understand. Just trying to
They,
give a scenario. That's all.
they have to, that's something else. Mm.
Well, it's kind of scary though.
Yeah,
Yeah,
Dr.
mhm.
Good morning, everyone. Dr. Callender. That paragraph that talks about the 2020, what they found hospitals and doctors in training sometimes conducts pelvic exam on women who, were under. And then it says sometimes these exams were done for the educational benefit of medical trainees.
That's correct.
So that says it all, I'm not going to speculate on that. I'm just going to keep that just like what it says.
uh-uh.
Any other comments?
One last comment. I didn't read this particular article. Did the law have anything to do with this? Money, insurance, and a lawsuit, or anything?
No, but it had to do with the recognition that Elizabeth is talking about, that in some hospitals, uh, training interns, medical students, while the patient was under anesthesia, did have vaginal examinations. Now, they were done to train the students, but nonetheless, these were done without consent.
Dr. Callender, how does that work? How would medical students who are under training get to do surgery?
It's certain not to do surgery, but in certain institutions, ours is not one of them, that the students don't get to do vaginal or rectal examinations as often. And so when the patient was asleep, they would get permission to do rectal or vaginal examination while the patient was asleep.
So would the patient know about that? I mean, why would the patient be in that situation? Did they volunteer to be examined or
Not as far as I know, and this is something that, for example, that is done in some institutions and not in others, where they think they have the right because the patient is under anesthesia to do a rectal or vaginal examination. Usually, if the patient has an abdominal problem, that is part of what is done, because your rectal and vaginal condition may be the reason why you're having the problem. But there are some hospitals who took this as an opportunity to have people in training to do examinations.
So my question, Doc, because I remember having going to Howard to get some dental work done for free, and dental students would be in training and doing that. How would that work with those other kind of surgeries that were not surgeries but exams like we're talking about? What would the patient be doing? What would they be?
No. This would mean that these are people who have for dental surgery. Nobody's going to do a rectal or vaginal examination. But if you have abdominal condition and you're put to sleep, that they would do a pelvic and rectal examination, and they would also, your doctor would do it, but they also had some teaching hospitals where the trainees would do it as well.
That's bizarre.
Well, this article doesn't even say what the patient was under anesthesia for. So I could understand it if they were, like Dr. Callender said, if they were maybe having something done in the abdominal area, but it doesn't really say that. It just says that the women were under anesthesia.
Yeah, so, that's why.
Yeah,
it's unclear.
So I guess if this particular lady was in a hospital that this was done, I could see why she would say, you have to have my permission before you do that. And I have to sign off on it. Because
how would she know? I want to know, how would she know? Did they bill her for it?
We don't have any details on that.
It
Dr. Callender
felt it.
Also, this was in Utah. So we look at the area where it occurred. Mm-hmm. That's a factor to consider.
Oh.
That's what kind of city?
I think at the top it says Utah.
Yeah, right. We said it's what kind of a city?
Well, I'm saying it was in Utah. So you have to consider the areas. Two things that came up in my mind. Number one, it was in Utah, okay? So it came through Utah. And the second thing is when they was talking about Medicare and Medicaid patients. So those are factors that we have to consider.
Yeah, well, it seems to me that Utah is used, but it's really not a Utah case. It's a case of they use that as a ground for the Utah Senate doing it, but that doesn't apply to the federal health agencies. And I think that the federal agencies were more relating what they found to the New York Times investigation.
Yes, I agree.
But anyway, it's going to impact all of the institutions, and they're going to require now that you have written permission, whether you put them under anesthesia or whatever. And sometimes this is part of the consent form of what you're going to do under anesthesia. And I think that you're concerned about those people who come in with other conditions who are not conscious is something that will still be permissible. But you just have to justify it when you write up your examination and indicate that you did it, why you did it, and so forth and so on.
Read the fine print.
Yeah.
In other words, doctors can't just train on you anymore. That's kind of what I'm getting out of all of this.
That sounds like a reasonable conclusion. Nor should they have done it in the first place. This is an article about using topical analgesics. And as they do more tattooing and hair removal and microdermabrasion, tattooing and piercing, they're using products that have a high percentage of lidocaine. And lidocaine at certain levels causes cardiac problems.
Oh.
And so as a consequence, it becomes important to let people know this so that they don't willy-nilly use high doses of lidocaine, because high doses can cause other problems. And I think that, as you know, tattooing and all of that stuff, those skin surgeries is becoming more and more common. And as they use these high doses of lidocaine, the side effects and complications become more evident. And so they're warning people that you see it talks irregular heartbeat, seizures, and breathing difficulties are side effects of high dose lidocaine. And so you have to be careful.
Lidocaine is in those rubs and patches for pain.
Right. Some of them, right. And when you get above 5%,
right, that's what
then
they're at,
you get
5%.
above 5%, you get into the vicinity of cardiac irregularities and other complications, seizures as well. Yeah.
So, Dr. Callender, are these over the counter, or do you have to have a prescription to get them?
I think that you have to have a prescription for most of them, but I haven't noticed whether they have these high percentage lidocaine over the counter or not.
They're 5%, the patches that I've gotten.
Right. Well, and these are 10%. The ones they're talking about are 10%.
I got some prescription ones that are 5% also. So I don't know about, I haven't seen anything higher than 5%.
And they are talking about the 10% ones as well.
Yeah.
Mary Ellen, I have those same ones. Matter of fact, I gave some to Sylvia, and she said she was going to give them to her husband. Those are 5%.
Yeah.
So I was going to ask Dr. Callender about how the lidocaine is applied, whether there are shots or whether it's just cream or what.
No, it's just the skin, but it's absorbed through the skin. And
So it's like a cream.
And it's like
it's absorbed through the skin. and can cause cardiac irregularities or epileptic seizures.
They
So-
in dentistry, they have a lot of cream that they put on your gum before they give you an injection. And sometimes they have injections that have no lidocaine for people that have heart problems, but that's a higher percent, I think, than that might be higher than 5%.
I don't think so.
I don't recall, but I know that
No,
that's what they
we
use.
tend not to use anything higher than 5% because of the side effects that we've noticed with
Right.
lidocaine products.
Dr. Callender, I noticed that a friend went into the hospital to have surgery. And one of the questions they asked us, do you have any tattoo? And she says, no, why? And the doctor says, because if you have any tattoo, there's a special tape or something that they have to put over the tattoo so it doesn't interfere with the surgery.
Okay. I'm not familiar with that as an issue. So, but then, of course, tattoos are now becoming so common in all ethnic groups. Tattoos and piercings, and so nowadays it's common to have piercings and tattoos. So,
When someone is getting a tattoo, don't you think that they possibly use some kind of lidocaine to numb the area before they start?
sometimes they do, yeah.
Or maybe that procedure is higher than 5.
Oh, that's what it's addressed for.
That's what
It's
I
addressed to
thought.
those
Okay.
procedures,
That's
yeah.
what I thought. Yeah. Okay.
Now, this article addresses something that was in the last 5 years has become evident that pulse oximeters actually are great, but in people of color, sometimes they give faulty results because of the darker skin tone. This is something that is well known now, and this is important because in the ICUs, the pulse oximeter is one of the commonest used ways of identifying the oxygen level. And so if you're a lighter tone, it's not as problematic as if you're a darker tone skin, in which case the pulse oximeter is going to be inaccurate. This became important, particularly with the COVID, because the faulty results could result in patients being unnecessarily intubated. And of course, if you have COVID, one of the things that you always do is you find out what your pulse oximeter is. And if it's under 95%, it's a concern. Any comments? It's important that this be known wherever you go. So,
What shade do they consider as dark?
I'm sorry?
I said, I wonder what shade they're considering as dark. We have so many different shades of, pigmentation till.
Yeah. Well, the darker the pigment, the more likely the
Okay.
inaccuracy of the pulse oximeter.
Dr. Callender, I question that because when you use that pulse oximeter, it seems to me, I don't know if I'm getting this wrong, but where they pick up the reading is on the pad of the finger rather than the top of the finger where the pigment is. So
Pigment is in both places. Pigment is on the top and the bottom. It's just that for some people, the surface that you're talking about is lighter than others
Oh, okay.
or darker than others, right?
Okay, yeah. So I was just thinking that the pad of the finger,
That's correct.
you saying that that is darker in African Americans?
Yes,
Mhm.
Okay.
yes. And this has been studied by many and and recognized that in the ICU they have to be careful because the oxygen saturation may be lower than what it reads.
So that would mean that you could be more ill than the the oximeter's reading. Is that what you're saying?
Well, and yeah, it means that the oximeter might give you a higher reading than you actually have. So when in point, instead of it being 98%, it could be 95%. And then, of course, if it's inaccurate, uh, that might mean that you uh, would be thought of as having normal oxygenation, when in point of fact you have a lower oxygenation than you actually is reported.
Get that.
Dr. Callender, which instrument takes an accurate reading?
Well, the most accurate is arterial puncture. That's the most accurate, but that's painful. And so that's why the pulsometer has become very common, because it's painless. The arterial puncture, which is the gold standard, is often very painful. You got to stick the needle into the artery and get the blood, whereas this is painless. You just put it on and it registers the oxygen level.
Dr. Keller, speaking of puncturing the artery, I just did my 107th blood donation yesterday at the NIH.
Yeah.
Oh, congratulations.
And that needle that they use for blood donation, that's a big, that's a big needle.
Well, the venipuncture is not comparable to the pain you have when you have an arterial puncture. So the venipuncture is relatively, and of course there's some situations if you don't have good large blood vessels, where they sometimes will just give you local anesthesia so that you don't feel the needle. But if you have big blood vessels, it's not necessary, and so the venipuncture is usually not very painful, whereas the arterial puncture, which you use to get the oxygen level, is often associated with pain.
Dr. Callender, while we're on this subject, that needle that they put in you for dialysis is very large too.
That's the largest needle you're gonna find, is the
And I
dialysis needles.
okay, and look, I put lidocaine, I rub lidocaine on the site before they puncture.
Right.
So I'm connecting the two issues.
Uh-huh.
Yeah, that's the biggest needle, that for dialysis, and you have big vessels and they put that in there. And some people either have lidocaine or they inject uh, uh, xylocaine into the area, and then they stick the needle through that area so you don't feel the pain.
Yeah, I used to put it on with a Band-Aid before I went to dialysis. I put the lidocaine on the Band-Aid, put the Band-Aid on the site. I got to where I'm going, they take the Band-Aid off, and I said, "This is where you stick the needle, please."
Okay, thank you for sharing. This is something that we are now, the social determinants of health have helped us recognize that there are socio and ecological factors that mitigate racial ethnic disparities in breast tumor biology. You know, we've long recognized that Black American Indians and Alaska Natives had great odds of breast cancer and had poor outcomes after breast cancer than other people. And the question was why? There have been many studies. I think Harold Freeman was the first to win the Alaska Prize for recognizing that the social determinants of health were one of the biggest reasons, and also to do something about it. And we now know that also that the breast tumor, the types of aggressive breast cancers that they have is also significantly different. And these numbers attest to that. And I think that it's becoming clear, as I think Darryl had mentioned, not only is the place you live in, but also the pollution, air pollution, is part of the issue as well. And so that it appears that for almost everything that we have, part of the disparity is related to the social determinants of health. And this kind of addresses the issue for the urban population, but not so much for the rural populations. And most of the Native Americans are in rural populations. Any other comments relative to this? Not, I guess none of this is new, but it's. Yes, Mariel? Oh. The next article talks about the fact that 1 in 8 women indicated they were disrespected or mistreated during childbirth. Any of you have children, and did you feel that you fell into that category? Your complaints were ignored, or they refused to help you with your concerns about pain or anything else when you delivered? One in 8 is
That's a lot of people.
1 in 8 is not huge, but it's still should be 0.
I think changes in childbirth methods and things they do now, a whole lot different than the women on this panel went through when we had childbirth.
That's true. Epidurals became part of almost all deliveries. And so that pain was much less of an issue. Whereas many of you had different different treatments.
For myself, I had natural childbirth all 3 times. So. And at Friedman's, I might add.
Any other comments? If not, this is interesting.
There's a lot of procedures that's stopping now. They used to shave you, cut you, and everything. And I've heard that they stopped doing those things. But now you have a baby 1 hour and they kick you out the next hour. They they don't give you enough time to rest. You need at least a week to let that baby, somebody else feed that baby before you get up 24 hours a day. Other than that, they are treating them, but they don't subject them to as much pain when you have it in the hospital. They gave you the epidural, but I forgot that procedure they call where they cut you to prevent you from tearing, but they would just do that automatically and shave you. But
Easy something.
yeah, but now they don't do all of that. I heard.
I heard.
Okay, well, you can ask your children and grandchildren. This is an article about a company that had a global recall of sleep apnea machines. You remember last week, I think we talked about Inspire, the other option to the treatment of obstructive sleep apnea. And this is a company in Washington that had a global recall of sleep apnea machines because of and sinus infections and pneumonia because of the CPAP machine. It said it recalled more than 5 million since 2021 because of the internal foam breakdown over time, causing tiny particles and fumes while people slept. So this then, of course, is something that people who have sleep apnea and use a CPAP machine have complained about. And this company had to replace those machines. Any of you have trouble with your CPAP machines?
Mine wasn't on the recall list.
Yeah, I use a cleaner, so or so clean, and it uses ozone to clean it out. So unless I'm, away from home, mine gets cleaned every time I use it before I use it.
Okay, let's go to the next one. It's interesting how exercise also is linked to better sleeping. Of course, this is done in this is a European study. And whether it's applicable to us or not, I'm not sure. But I think in most of the studies that I've read, exercise is linked to better sleeping habits. And they recommend if you have trouble sleeping to exercise. But this study, however, is primarily a European study. And it showed that it was very helpful in reducing or if not eliminating insomnia. Now, last week we did talk about the fact that bird flu is something that has been noticed here in the United States. And there was a concern that if it is occurred in Texas, that it could go other places in the United States and around the world. And that this virus is something that should be treated and eradicated as quickly as possible because it has potential for severe avian influenza. And it affected not only humans, but other animals So xenozoonosis, which is what it's called, the infection from one species to another. Great example, of course, is HIV. But the CDC is doing all it can to make sure that the avian flu is not transmitted to any more humans. Because as you can see here, we lack immunity against that avian virus. So the flu vaccine doesn't protect us against it. Okay, this is an interesting article that we haven't discussed the events that are going on in Israel, but the World Central Kitchen was sending relief efforts, and 7 of his workers were killed by the Israel military. What are your thoughts about this? We have a situation in which Hamas decided that all Israelis should be eliminated, and then Israeli countered with saying all the Hamas should be eliminated. So man's inhumanity to man is unrelenting. Any concerns? Any questions about this article?
Yeah, it's unfortunate.
Yes,
War is hell. I tell you one thing: war is hell. That's for sure.
Yeah, the other thing that really bothered me, as you all know, I was a fan of artificial intelligence until I saw a news story which showed that they're using AI in war. You know, that's horrible. I mean, finding out.
Well, I mean, war is horrible.
Yeah,
war is horrible, right?
Yeah, yeah. So now they're using AI to pinpoint how to kill people and stuff.
Not surprising.
Yeah, I hate hearing that.
War should be eliminated. I mean, man's inhumanity to man is just remarkable.
You know, the background story, people don't really look at that too much. You know, Israel wasn't a country, and then it became a country. You know, when the Israelites were, you know, being killed in Germany, and they immigrated to that area. That was Palestine, I think, and they took over that area. I mean, that it was somebody else's country. So I mean, there's definitely a basis for argument and a basis for war. I mean, you bringing somebody in, and you know they're going to have a country. You know where your country was. You know?
Yeah, Europeans came over here and took Indian country.
Yeah. United States was implicit in that after the war.
Yeah, we have a lot of instances where certain groups of people go around and steal other people's property, country, whatever. It's horrible. And war is behind most of it.
Like Ukraine as well.
Yeah.
Okay. Good point.
Well, you know, when you think about it, when have we not had war? You know, it started with Cain and Abel, and ever since then, it's been war and
bigger and bigger.
And it's not gotten any better. Gotten worse all the time.
It's bigger and bigger.
Bible said there was war in heaven.
What?
the Bible says there was war in heaven.
Oh, yeah.
That's correct.
Kicked out.
Michael.
That's how Lucifer was, that's the war in heaven, right?
Mm-hmm.
And it also says there'll be wars and rumors of wars. So
And it's gonna get worse.
it's going to
Right.
get worse.
Yeah, well, I'll take the rumors more than I'll take the actual war.
Well, you're gonna get
You
both.
have no control over it.
Right. You're gonna get both. Ready or not, here it comes.
Yeah.
That's bad.
Okay, I just thought I'd include it because that's part of what we have to face daily. And then, you know, you have one group saying, we're gonna kill all of you, and the next group says, we're gonna kill all of you. And where does it end? I guess it doesn't, does it?
No. Unfortunate.
Yeah, I heard that they're gonna blow each other up, just tear up the earth.
Well, that's next. Yeah.
Yeah, they'll kill all of us.
Right.
That's the thing. Or what I worry about, they live a lot of wounded people. Wounded and mistreated people. And that's what has fueled a lot of this resentment, years and years of mistreatment and abuse.
Women and children.
Right.
Okay. This is something that was mentioned earlier that I think Tatum pointed out that the older people are having STD skyrocketing incidences. And although many people think as you age, you become less sexually active, that apparently is not the case. As sexually transmitted diseases are particularly on the rise in people who are over 55. So it is a cause of concern. The different chlamydia and syphilis and hepatitis C, gonorrhea, old friend diarrhea, yeah. Any comments or questions? This is just an observation that is made that the over 55 population is as sexually active as ever and suffering the consequences thereof.
Go back up a little on the article a little bit, John. A little bit more. Higher. Yeah, I wanted you to get up to the part that showed the whole list of STDs, together. Yeah, that is it. And Dr. County just mentioned, you put all those together and you talk about some ugly words.
Yeah.
Chlamydia, hepatitis C, syphilis, gonorrhea. It's just a bunch of ugly words.
Okay, let's go to the next one unless you want to discuss it.
What's the cure for that?
For what?
For senior citizens not to have all these STDs.
Why you want to know?
Wait a minute, John. Freedom of speech, man. Even if it's
I think, okay, we got this out. The baby boomers, we're at that age now. So what are we doing more that other generations didn't do?
Well, I just think we're larger, and we are a lot more sexually active than our predecessors. Maybe they weren't as common. Not as many people lived to be as old, and these older people are still sexually active, and
I don't think we're more sexually active than the older generations.
I think we're larger.
We're larger.
Yeah,
and,
I think there are
things
more
have
of us.
Yeah, there's more of us, and I think there's things because there's more of us. Because you even think of the older generation, people have always had sex until the day they died, if they possibly could. And the nursing homes have always even been credited with having that high risk of sexually diseases. Maybe because we don't take as much precaution, or because we're living longer, people are by themselves more, so they have to go out among strangers or anybody else because they still will have that sexual desire. So there's something in our generation that didn't happen in the other generation. Did couples live together longer, or we have more single people? Can anybody think about why? And most of us in here are these baby boomers. This is our age group. What are we doing differently than our parents' age group as far as sex?
Access and less inhibitions.
Well, one thing I thought of was the fact that we have all of these new medicines out that, for elderly people, to feel better and everything and make you healthier, all these new medicines out. And now that's one reason why elderly people are living longer, because of these medicines. So that's one answer for me, just all these medicines that keep you alive longer.
I had a question, Dr. Callender. To me, it's odd that Hep C is included in sexually transmitted disease. I always thought of Hep C as being related to heroin addicts and needles. So obviously, it's a sexually transmitted disease, right?
Right. It is. It is.
Our generation has forgotten that when you go out in the rain, you should put on a raincoat.
That was exactly what I was getting ready to say. Go back to the old ways.
We're at the generation where you feel that you can't get pregnant anymore. You can't, that woman you haven't, they can't get pregnant, and I'm not going to be fathering another child or something like that. So we're just freer.
And then there's a thing about in the younger generation, syphilis is up. And there's always been sugar daddies. So sugar daddies are bringing syphilis into the older community.
Very interesting.
Yeah.
All right. So maybe we can forget about it.
It's very tragic. Very tragic.
Who brought all these articles up?
Now, this is another article that highlights the fact that we don't really have a cure for Alzheimer's. And so one of the concerns I have about early diagnosis of Alzheimer's is to recognize that we don't have a treatment. Therefore, the family needs to be involved in helping out these people who have the Alzheimer's, so that they can be prevented from hurting themselves or others. But the fatalities from Alzheimer's are ever increasing. And our ability to treat it remains not present. We have many symptomatic treatments that don't address the elimination of Alzheimer's, which is uniformly fatal. And we keep talking about these medications, but they just prove that we don't really know what is the cause of Alzheimer's. Because if we really knew the cause, we'd be able to implement treatment. And all of the efforts that we've had so far have demonstrated that we know how to make the diagnosis, and we may have ideas as how to prevent it, but once you have it, it's it's really the family that can play a role in trying to help the patient survive until the disease kills them.
Elizabeth George yesterday, the Washington Teachers Union retirees there are several tables, and she just happened to give me a book about Alzheimer's and how you live with it. And I had received articles before, but I was interested. And the main emphasis was showing you how to live with someone because there isn't a cure, but it's a principle for life of living with each other. About arguing with someone, they'll say state a fact and you want to correct them, but in their mind, they're confused, and giving them compassion. It was a well-written book, and she was just giving it away because nobody was really taking it, including me. But once she put it in my hand, I just stopped for a minute to look through there, and it has all these suggestions that we see here, but what to do in the things like when they get mixed up and putting things in various places that shouldn't be there, or say things, or their behavior, or when they start walking off and stripping and all that kind of stuff. But it was a very good book that was really nicely done. And I would like to thank Elizabeth George, who's on our panel. Thank you very much. And that was a book that more people should have paid attention to.
Thank you, Carol. I really appreciate that.
And I think the emphasis this article has is very similar to what you're talking about, is that how do you deal with them and how to protect them from hurting themselves and hurting others as long as they can. Because we don't have a cure, but we do have ways of keeping them from hurting themselves and hurting others. And we have social structures that help keep one person from having to bear the brunt of taking care of a person with Alzheimer's, and it talks about the fact that you don't try to correct them, you're trying to help them. Any other comments about this dreadful disease that is becoming more and more common?
Yes, the statement that you made about family, I think that the family really knows the person better than any doctor or anything else. And if it's at all possible, I think the person should be kept at home as much as they possibly can if there's someone, because you just know the person, you know them, and you know when things aren't quite right, and you know how to talk to them, and you know and I think they don't know for sure, but I just feel like they are more content being in surroundings that they're familiar with.
Except the problem is that if you have a large family and the family is willing to work with them, then it's desirable. But if you have a small family and it's one or two people, then it becomes important for you to use the social structures that are available because they have groups that they can go along with and still come back to home, but spend some time so that the person who's taking care of them doesn't kill themselves trying to take care of the patient.
Very different.
That part.
Dr. Callender, that's so true, because in that booklet, it was socialization, but a lot of times even the people at the home, they don't recognize the symptoms and what they're doing, and they got to be reminded. And the caregiver, the one that's really ultimate, they also need care, and
Right.
they need someone to take that person off of their hands so they won't go down.
Right.
It's a whole village. So that person needs to get out. The person that's taking care of them get out. But the family, a lot of times the family doesn't realize that that person have Alzheimer's, and they're going to treat them harshly. You said that once, didn't you? Remember when I told you to do that? They are very harsh on that loved one. thinking that they're helping that person and they're not.
Yeah, I had that same issue with my mom. You know, she kept asking the same questions over and over again. And, you know, people were saying, why you treat her so mean? And I had to look at it, you know, because I had no idea what was going on. But subsequent to that, I went to Iona Senior Services, which is right here in DC, and they have support groups for caregivers. Very important, very important. Iona, IONA, and it's very inexpensive groups that they have for the caregivers and the family members and the family members with dementia or memory.
Right.
My mother was also that way. I knew it when she came to live with me from Indiana, but on the way we talked it, we discussed it. But sometimes you can get so involved that you forget instantly because one moment it's lucid and next moment it's repeating or saying something. So I would have to go back, just like I do reading my Bible. I would go back, remind me these are the symptoms and this is how you should react, because you very quickly forget how you should really react. So I would just go back, read that booklet again and say, okay, this is what's happening, to remind yourself, but you need to have that on your mind constantly because it goes back and forth.
Then too, it's also each patient is different. So you really have to know exactly what stage or how far, or because each person is it's a different thing.
So Elizabeth, bring that book back again next meeting.
I have a friend who has a mother that's combative, and she threw things and she hit and bit, scratched. It was a lot.
Okay, well, it's an issue that we all have to deal with, and it's nice that everybody is so sensitive and understanding, because it requires all of that and more. Is that the last article?
We actually have two more.
Okay, good. Okay. All right. So everybody take care of your income tax, and we see you all next week.
Okay.
All righty.
Okay.